cervical spondylosis is a natural wearing down of the cartilage, disc, and the ligaments and the bones into the person's neck. So it is a way of a degeneration for, for the whole spine. So if it's more serious on the neck, then we call it cervical spondylosis. The causes by the general understanding that is like a degeneration. Our aging is growing up, so you're getting the bone is weak, or the arthritis or osteoarthritis, or the bone space. The bone is weak, so the space is coming to attack the nerve. Then you feel those sensations, those symptoms. The young people also will have it, because we have to understand why the bone space is coming. For example, that I am the cervical vertebra. If I want to make myself to be stable, one person here 100 kilo hold me, one person 100 kilos hold me. So if this person pulling more, like 120 kilo, this is 80 kilo, so my weight will be shifting to the heavier side, will be going to shift that side. So it's not only for the elder people, young people too. If the muscles is very stiff, so it will be shifting. When the vertebra shifting to one side, definitely they will go to choke the nerve. Then sensation will come. Sometimes main one is like the numbness with the one arm. And the stiffness with the neck. And also like the muscle spaces. The muscle is very pain, stiff, and also the dizziness, headache. Those one are all the symptoms. If it's for a long time, also can be causing from the hypertension. So like even some people, they will have the electricity shock. You know, the one arm getting electricity shock feeling. They have a professional to do the checkup, do X-ray. You go to the doctor to check it and to have a treatment. Or in the house, you can use hot water, hot towel to release it. Because the hot things, it will be release the tension for the muscle, release the choke area for the nerve root, then will be better. This is the most, the normal tongue in our body, the most normal tongue. We can't get it in real life. So like the shape is very nice, like a U, and the inside is very flat. So it's not shifting, not going to one side. Very nice one. And then we have to understand, like when we check the tongue, we call it holographic reflect on the tongue. Before we see like that, so this is the neck, this is the head, this is the spine when the tongue pull out. And we have to understand that, like our body, the bone, who is supporting or connected each bone to join together is not be those the muscles. So when we lost the balance, muscles squeeze more, then the spine will be going to that side. So we can easily detect. And this one is the same thing. You see the in between, this is the spine. The spine is shifted. Everybody can check your tongue from the mirror, even from your phones. Everywhere is connected in our body. Same like the tongue body. You check the pink inside, you can see the internal organs. From the tongue coating, you can check the outside muscle. That is how Chinese diagnosis for the problem. And since you know this is the upper back of the body, you see we divide it for 3 parts: upper, medial, lower. Then simply you check. This is some of the patients. Every day I snap the picture, more than 100. So you will see this one peeling up. Then you will compare with this. You will compare with this. This is the neck. So when this one, whether it's going down or coming up, the spine is coming up, spondylosis. So everyone can check the tongue from the house. This is one. You see, whether it's white, whether it's whitish, yellowish color from the tongue body, and when this one is coming up, the medial side is coming up, the spinal coming up, the cervical spondylosis will be there. So easily detect. And at least you do something, even the warm up for the neck, or somebody can massage you, or you go to attending to the hospital if you're very serious. Because cervical spondylosis, when the age is growing, is something serious.
Yeah.
Because when the cervical, the vertebra is choked, the vertebral artery also will be choked. Same like the water pipe. Close the water pipe slowly, gradually. Then the blood supply to the brain will be short. Yeah, when the patient feel like electricity shock on the arm, numbness, you cannot move the arm, even same like a paralyzed, then should be quickly pay attention. Yeah, we diagnose it with the sickness with modern methods, like we also check X-ray, we also check CT scan, MRI. Of course, we also do laboratory for like uric acid, ESR, those detect whether rheumatism, gout is there or not. So follow those diagnoses, we'll give the treatment. It's treatable. For our side, massage, acupuncture, gua sha, cupping, Chinese medicine, the latest technology we call acupotomy. Acupotomy joint words with the acupuncture with anatomy. Based on the anatomy, which muscle is very stiff, then we do the needle. It's a little bit bigger than the normal needle. So we do it relax the tension from the muscle to make the balance well. Chinese medicine is a balancing game.
Yeah.
Yin and yang is balancing. Positive energy, negative energy is a balancing. So if the strength, like the both side muscle is one side is very stiff, another side is weak, then we have to balance it well. When balance is all right, then everything should be getting very good results. The preventive measures, number one, you sit well. You sit straight, make the spine posture very well.
Wow.
And also when you're watching the phone, to protect yourself, when you're watching the phone or computer, it's straight. Many people, they are bending down very well. Then the muscles
we always
one side
slouch
very stiff.
like this.
Slouch it. Then front muscle will be very stiff, choked. So when you sit well, like the student in the school or army person, long time, one side muscles be very stiff. So you see many people's tongue shifted. Same like last time when we did the program for the stroke. Have you seen a lot of people's tongue, the patients, they shifting one side. Why? Muscle stiff. Because cutting from the brain. The stroke people. You have to do some exercise. Like one time, long time you're watching for one point, concentrate like for computer, mobile phone, working. You rest up the shoulder. You should do some exercise. Like you can do the simple exercise to prevent. You can making the neck bigger round. You can check where is the pain. If you turn to this side, here is the pain. You stretch it. Try to stretch it. Let the muscle to be pulling it a bit. Then you can do the neck like turning left and right maximally. You have to from left to right should be 90 degrees. You hold it. Then you from top to down. You bend. Then also slash it from the top to this way. You can do more exercise. Then you're making 10 around. Not only 10. When you turn for one side, like for me, when I turn for this side, here is stiff. Hold it 15 seconds. You relax. Then you do another one, 30 seconds. Where it's painful, then you can try to stretch it. Stretch exercise for physiotherapy is very important because all is controlled by nerve. Those nerve is choke. You can try to give a little bit pressure to release the fascia, release the muscle. Then the choke area of the nerve also be released. Yeah, it's quite. Clinically, we had a lot of good results for the spondylosis. And we can say that for other treatments, we can say that degeneration of the bone or the age is growing. There is no curable, but we manage seriously, very well. Even one patient, first time when we do the treatment for the patients, 80%, 90% can reduce the pain. They were very excited.
Wow.
Acupotomy is the new treatment. It's not only Chinese medicine. We join so many things. Joined with Western medicine, joined with a nerve system, joined with the fascia system, joined with the old Chinese methods like the acupuncture, everything. That's what we call it acupotomy. Acupuncture with anatomy. So it's very good results. Prevention better than cure is the old word we're always going to say. If you have like the stiff neck and dizziness, headache, and the numbness on the hands and the electricity shock, so you can come to us. Do the treatments somewhere. It's also fine, but you do the exercise yourself. If you can't get good results, you can come to us. We're ready. If we can use exercise to handle the case, no medication, no acupuncture, Many people, they're scared of the needle. So they don't do it because I'm scared of the pain seriously. So I try to use many ways to minimize the pain. We do anesthesia, even anesthesia cream on the skin.
Oh, okay.
You leave the cream there for 1 hour, 2 hours before you will do the acupuncture or anatomy. Even if deep tissue, we need to release it. We give injection to that particular area to numb the area, the anesthesia.